Parents have been asking for my aid. I guess you call it first aid, in helping them know when they need to have their child's cuts and bruises seen by a doctor. Well, let me see if I can leave no one wounded with some information on minor cuts and bruises. Most cuts or scrapes to the skin surface can usually be handled safely and well at home. The treatment is simple and begins with lots of washing of the cut with soap and water. Water under some pressure is great, such as with one of those sink hoses, to clean debris out of the cut. Once clean, apply pressure to stop the bleeding with a gauze pad, and then cover the cut with a bandage on top of the gauze pad, enough to cover the cut and the skin that surrounds it. When do you worry? Well, if despite the pressure of the gauze bandage, blood is soaking through not one but two gauze pads and doesn't stop in at least 15 minutes, if the edges of the cut are widely separated, the cut seems deep, or continues to ooze and bleed despite the pressure, then seek medical assistance. If the cut is on the lip and crosses onto the face, then a doctor should be consulted regarding whether stitches or special adhesives are needed to bring the cut together. If it's due to an animal bite or scratch, talk to your child's healthcare professional to see if antibiotics are warranted. Finally, if you're unsure if your child has their tetanus shots up to date, that warrants a call as well. Of course, the best way to deal with a cut is to not let it happen. So make sure your home is safety-proofed appropriately and your pediatrician or child healthcare professional can help with this activity as well. Hopefully, tips like this will put you on the cutting edge and bandage any concerns you have when it comes to knowing when to worry about your child's cuts and bruises. This is pediatrician Dr. Lewis First from the University of Vermont Children's Hospital, reminding you to always be first with your kids.